think we're about ready to start. I'm Cindy Ehnes, the person who asks all the questions, and like I say, I appreciate the fact that Margaret is always very willing to let me do that because as we all know, this who knew healthcare was so complicated as we know, but we do know that. We do know that, and I think partly those of us who have been to many of these conferences have come to just so appreciate the ability that Margaret and Paul have brought us to synthesize and to pull together many of the streams of healthcare and the strings of healthcare into something that becomes more actionable. And I don't say actionable because I'm not sure we're there yet, but more actionable. So I'm pleased to moderate the panel today that's the outlook on the state's health care in both California and in Arkansas. And on the panel today, we have J.C. Cooper, who is Assistant Deputy Director of Healthcare Delivery Systems at the California Department of Healthcare. And then Lance Lang, who is the CMO at Covered California. Joe Thompson, who is President and CEO of the Arkansas Center for Health Improvement. And then Michael Schrader, who's CEO of Cal Optima. And first up, we're going to ask JC to really kind of set the stage for us with the state budget on healthcare and talking about her role within that and the role of the Department of Healthcare Services. JC serves as the Assistant Deputy Director of Healthcare Delivery Systems at the California Department of Healthcare Services. And JC brings, I think, some very, very significant and important qualifications to her job, to her role. She started at Kern Medical Center and, in fact, started in a position working with Copel Solutions, which is the company I work with, in implementing the N1115 waiver, correct? Yeah. And then went and helped implement the low-income health plan and has done a number of things that give her a unique perspective within the delivery system and within delivery system models, as opposed to what we often see at the state level, which is a very top-down, I know healthcare policy, but I don't know much about actually how healthcare gets delivered. So I think that's a unique and an incredibly important perspective that she brings to that. So with that, I will welcome JC to set the stage for us. Thank you.